Oh my God. Oh! Trampoline traumas, fierce slap fighting, and a knockout or a checkmate? What?
What?
Today we are breaking down some of the most bizarre medical scenes and unexpected injuries from some of the strangest extreme sports on the planet. Let's dive right in. Oh, cool, like trampoline, sweet. Professional trampoline flipping.
Trampoline! Trampoline!
Athletes that are doing acrobatic tricks on a trampoline, flipping, tumbling, but it also requires like a ton of skill and excellent control. Things can go wrong in any professional sport. I'll never forget, midway through my residency, they opened up a trampoline park near the hospital I worked, and literally, we would get people come in all the time with broken ankles, sprained ankles, broken wrists. Oh. Oh! Man, you're not supposed to bend that way. You can fracture the bones of the spine to where you actually sever your own spinal cord. Not knowing exactly what happened to this individual thereafter of the injuries, but the things you need to worry about is paralyzation mid-abdomen down. Oh my gosh. I love how they do this, like measuring. And you're using your whole, torso, just like you're throwing a baseball. You rotate to get all the leverage using your core muscles. Oh, he's not knocked out. Oh my gosh. Okay, so at least they're using a mouth guard so they don't knock their teeth out or bite their own tongue off. Good to use in sports where you potentially could get facial injuries. Oh, geez. I see cotton in their ears, and this could be just making sure they don't get any injury to the eardrum itself, the tympanic membrane, because if you do have a lot of force and the air pressure change within the ear canal itself can cause the tympanic membrane, aka the eardrum, to actually rupture open. Oh. It doesn't seem like it's a massive hit, but it is a massive hit. People pass out. Your brain is being shooken from side to side. Could you cause a jaw dislocation or fracture? Yes. Could you cause a maxillary fracture? Yes.
Yes.
Oh my gosh. Sweep the leg! So you're trying to knock somebody over by kicking their shins. Okay. What type of injuries would actually typically happen? We didn't see any bad injury here, but the common ones are abrasions, lacerations, contusions, or like bruising, or big hematomas. Oh, repetitive trauma to your shin could cause some nerve damage to the area, could cause muscle damage or tendon damage. But you also think about people who get shin splints from just running. If you're hitting a bone, you can potentially have continued breakdown of the bone. Breakdown of the bone. If it's done in a certain way, it can actually build up the bone as long as it's not totally broken. But then the other component is a lot of repetitive motions to this area might weaken that bone in a certain spot and make it easier for it to break in the future.
Oh no! And that seems to be the end of the round?
I think that's it. That's 2 minutes.
And there we go. 2 minutes down. We're back to boxing.
This is chess boxing. 2 activities in one. One round is playing chess and the other is boxing until somebody wins at chess or gets knocked out.
He's thrown multiple 1-1-2s just like that one. Going to the body for the first time. Oh, and here we go. Stan's getting a standing 8 count.
Oh, left shoulder's dislocated.
Looks like he's injured.
Oh yeah, it's out. So if you guys see on that left shoulder, you can see that there's a weird prominence. That's actually just because the head of the humerus, which is this bone in your shoulder, is actually out of socket.
It looks like they just popped it back in place.
Oh, they popped it. We didn't get to see. They popped it back in. That was pretty quick. There's many different ways to do that. You can actually hold it really close to your body, have somebody pull down on it and externally rotate the shoulder. Sometimes you can pull on it. Sometimes you can have your friend massage your bicep, but most of the time people come to the emergency department and we put this in multiple different ways. Oh, wow, they're going, they're cruising. So obviously down in the appropriate position so you can be more aerodynamic. So we got helmets, that's good. And we got these cool gloves. I wonder if they're like sliders on the hands so you can actually slide and also like use your hands as a balance point. Oh my God. Oh! tries to put the hand down to balance. That is typically when you actually end up fracturing your wrist. It's called a foosh, and basically you're falling out on an outstretched arm, and you can cause a wrist fracture, distal fracture to the distal radius or the ulna. Jeez Louise, that's so not good. Yeah, you're sliding. That could rip through your clothes pretty fast and cause like road rash, a lot of burns to the areas of the skin. You might need to have a skin graft, but you also have to clean out the asphalt and maybe rocks that are now embedded into your tissue. Oh, look at this. I don't know. I couldn't be the person being carried. I feel like I would vomit. Just like the bouncing and you're upside down. Oh my gosh. Oh, man. Man, he slipped and just landed on her head. What? All I can think about is if I did this with Jen, she would literally kill me if I dropped her. Oh, look at this. She's like in bad shape. Oh, yeah. Oh, wow. I mean, that's why they have ambulances there. At least we got a helmet. We're wearing a helmet. Looks like really bad back pain. They put that individual on a longboard and then they put in C-spine precautions. If the helmet's there, you can leave the helmet on. You actually use the blocks that you see, those orange blocks next to the head. You can just tape the helmet to it so you don't move around the neck. Typically, they found, though, that people who have actual cervical spine injuries, they won't move their neck because it hurts.
Well, it hurts.
They're going. Look at these. Look at them go. Oh, we lost one. Oh. Oh. Wow. They just got rammed right into the rail. They are wearing helmets, which is good. They're wearing eye protection. But again, from a body standpoint, they might be actually wearing like chest and back protectors. You can, fall, fracture an arm or a leg, just depending on how you're falling. And then obviously you worry about like brain injuries, concussions. This injury highlights the importance of sleep for recovery. For improved sleep, definitely try Do Not Disturb by Life Happens. Available at lifehappens.com and on Amazon. A lot of acrobatic stuff, super cool. Because they're so buoyant, you can actually just cause a lot of shock to the system. So it's good to a point, but if you start getting so much shock to the system, those joints are gonna be yelling at you in the future, leading to potentially increased arthritis. I mean, it looks a lot of fun. Oh. Minus somebody falling. You can have a lot of knee damage in the sense of having anterior or posterior cruciate ligament, similar to like what would happen in the ski injuries, because you're having these things on your feet and it's hard to maneuver as if they're normal feet. They get caught and your body mechanics will actually twist in different ways. So these were really cool, very interesting sports. Again, should they be in the Olympics? Let me know in the comments. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And do me a favor, make sure that you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.